Gary Delaney. Dr. Delaney is here with us.
Morning, Dr. Delaney.
Good morning. Thank you for this opportunity to share some things with you. I'm Gary Delaney, and I'm a past president of the South Carolina Society of Anesthesiologists, and I'm a past president of the South Carolina Medical Association. So in my 40 years of practice, I've seen it all, and we've dealt with scope of practice issues for a number of years. It seems that everybody wants to be a doctor and nobody wants to go to medical school. And to that aspect, let me tell you that they may tell you how many hours they have spent in training. They will compare that to how many hours we spent in training. And it probably is comparable, but they were being trained as nurses. We were being trained as physicians. There's a real difference between the two. And they want to call themselves doctors, that's fine. But really, when you want somebody to care for you, you want to see a physician. Physicians do have nurse anesthetists, physicians have nurse practitioners, and they all work in a team approach. And so they want independent practice. Their hue and cry is that rural hospitals may have closed, and we were responsible for doing that since they don't have independent practice. But I can assure you that if rural hospitals closed, it was because the surgeons left, and there's really no cause to administer an anesthetic when there's no procedure. And so if hospitals closed, it's because the surgeons left and there were no need for anesthesia. And so we have seen all of this before. They will tell you that in 46 states, I believe it is, that we're one of the few that don't allow supervision, that require supervision. And it's really a matter of wordsmithing. Those states require oversight, supervision, any way you want to slice it. There is physician supervision of the anesthetics that are going on, whether it is a residency trained anesthesiologist or whether it is a surgeon or for a gastroenterologist. Excuse me. There are physicians that are supervising these people. And I will tell you that I have seen in my years of practice people that have come ready, we thought were ready for the operating room, and I held them up because they weren't ready. And so you need a physician to evaluate those people before they come to the operating room. A tenet of ours in medicine is primum non nocere. That means first do no harm. And you don't want to take a patient to the operating room that is not ready, whether their diabetes is out of control or their heart disease is out of control. And those pre-op evaluations are done by anesthesiologists, and they are the ones that control whether people go or do not go into the operating room. The recovery room is also a very special place. It is a high level intensive care unit. Anesthesiologists are in charge of those recovery rooms, and they are there to take care of people as they recover from the anesthetics and those effects of the anesthetics wear off. I can tell you that the anesthetics that we give are the same things that people use for lethal injection, but we've been trained how to do them. And so those are very potent drugs, and anything that scrambles your brain and keeps you from feeling what a surgeon or a endoscopist does is a very potent drug. And they all can have some very serious side effects. And so I think what we need to understand is that physician supervision is important because not only preoperatively, but intraoperatively as well as post-op. And that's where sometimes you can get into trouble. If you haven't got the patient prepared right, you could have trouble. If you have problems in the recovery room and the surgeon isn't around, then that was our responsibility to take care of those patients. I'll be glad to answer any questions. I want you to know that you should go back to your constituents and be sure that they realize that by not passing this bill, you have provided them the best level of care that you could possibly give them. So I thank you for your time.
Thank you, Dr. Delaney, and I'll go ahead and